what happened with the very first patient that you mentioned at AKU, and how did your time at AKU, or did you have feedback from Hazar Imam from your time at AKU in regards to the work you did? That's my one question, and I'll leave it to Neymar to unmute everyone and facilitate the mediation of questions. Thank you.
Okay, so I'm going to give you a Mola Bapa story, uh, which is essentially meant to make a few very sincere and honest points. And at no stage through this story that I'm going to tell you should you feel that I'm trying to brag or anything like that. And so please give me that license to tell you the story. So this is a 1994 convocation at the Aga Khan University Hospital, and I'm getting into the story of the first patient. And this is the slide where Hazar Imam is seated with all the dignitaries, and the speech is being given by the professor of surgery, general surgery. And I was not even there at that location downstairs at AKU. And I was the head of the cardiovascular program and had put the program together. So then Hazar Imam comes upstairs, and he's supposed to officially do the ribbon cutting ceremony. And that's where I was with my teams that I had brought from Canada, from University of Maryland, the Pakistani team, and all these people from different areas that I had put together that were going to help put the program together. So we go upstairs, and all the dignitaries come, and the officials, and Hazar Imam comes with this entourage. It's a narrow corridor. I had set up the ribbon and two Ismaili nurses there to give Hazar Imam the scissors and all that stuff. But I am being left behind in this process. So I'm stuck somewhere there. And Hazar Imam, if you can see in the picture, I don't know how clear it is, he's already even got the scissors open. And he's got his hand on the ribbon ready to cut it, but he's not going to cut it. He turns around and he says, "Where is Dr. Alnoor?" And so everybody is looking back at me and motioning me to come forward. As you can see, that's Lee Hilling, the CEO of AKU Hospital. There's Princess Zara. She's trying to get me to come over. And I come over, and then Hazar Imam asks me, "Doctor, are we ready?" And I say, "Yes, Khudavid, we are ready." And he cuts the ribbon, and I'm actually about to cry. I hope I don't. And we do the opening ceremony. So we try to go in, and he says, "After you." He's telling me to go ahead, and I'm saying, "After you." I'm not going to go in front of Hazar Imam. And so Princess Zara comes through, and she starts going forward. So it makes it easy for both of us. And then the three of us enter the area, which enters directly into the operating theater and the cardiac catheterization laboratory of the hospital at the university. So we go in there, and I thought that my role was to show Hazar Imam the equipment and just give him a little tour of the facility. And maybe he might ask me to show him the angiogram of the patient that I had done the previous day. So I'm getting to this patient issue that I had done the previous day. So we go over all that, and I've talked to you about this slide, and he interviews me and asks me all kinds of questions, and I'm sweating in every pore in my body and trying to give those answers on the fly. So then what was supposed to have happened with regards to this program, that Hazar Imam had put two conditions. That with this we had planned to do the cardiovascular program in 1990, and it was all ready to go, and we didn't go ahead because of the Gulf War, and everything was put on hold. So now we were ready to go in 1994, 93, 94. So in 93, we started redeveloping the program and getting ready to open it in 94. So his two conditions were that the program should be ready and functional at the time of the 10th anniversary of the university convocation in 1994. And many of you were probably there at that ceremony. And the second condition was that he wanted the funding for that program initially to come completely from inside of Pakistan. The donors had to be all by. So no foreign money was collected to develop the cardiovascular program at AKU. I don't understand the full reasons for it. I have some opinions, but this is not important for this story. So everybody was aware now about this, and everybody knew that I was going to do the first patient, and it had to be done. He or she, before the opening on that convocation day. And we had major troubles with the equipment, and that's another story of the miracle that happened on the port in Karachi for the equipment that came from Japan. Oh my God. Anyway, so we won't go there. So everybody knew that Hazimam was going to meet the first patient and he was going to bless the patient. And so people had confidence that if they were the first patient, they were going to come through. Hazimam was going to see them, right? So they felt iman and faith that they were going to be fine. And by then there was a fair bit of reputation that I was very experienced, knew what I was doing. Hazimam had handpicked me to develop the program and lead the program. And with this last issue, I am telling you honestly, I'm not entirely sure whether it is true that Hazimam handpicked me or not, but that's the prevailing narrative. Anyway, so there was this big commotion and pressure on me to pick the first patient. And people used to come and ask me, who are you going to do and what patient? By then I was seeing patients in the clinic, and I was already looking after people who had cardiovascular disease because I had to figure out who had the problem and what patient we were going to do. And so, there was pressure. There was pressure from the leaders on the council side, pressure from the university leadership side, and, pick this Ismaili guy, and this has had a problem, and you've been seeing him in the clinic, and this and that. And I resisted all that pressure and basically told them that yes, and that I will decide and all that kind of stuff, but tried to not get cornered into somebody telling me which patient I was going to do. So I made a decision to pick this patient, this lady. This lady is a Hindu lady. She worked for over 8 years at the hospital in the housekeeping department. And she was socioeconomically in the lower scale and could not afford to pay for her medical services. But she needed cardiac help and care. And so she came to my clinics, which I was already running, and I had no problem looking after patients who were non-paying because I treated patients as patients, whether they were paying or non-paying. I treated the cardiac disease and the patient, not how much money they had. Anyway, so she had come to my clinic. I recognized her problem. She was having angina, like I explained to you earlier, the symptoms. I knew she had blockage. I knew we had to do something, and that we were equipped to be able to do it. We had a situation where we were claiming that we are a non-denominational, we treat all cultures, all religions, all that stuff. So I decided on doing her as the first patient and making a really bold statement that it is the person, it is the disease for which this program has been developed to be able to give the best care possible to the person who needs it, regardless of religion, regardless of gender, regardless of influence, regardless of being ability to pay or not, that we were going to do that. Hazimam was so elated. I saw him so happy as we came out of the cath lab. And Monique, who was the nurse, who is my wife now, who was training the nurses there, and she had assisted me in doing this procedure on the day before. She had wheeled out the patient, and Hazimam puts his hand on her shoulder, a Hindu lady, and blesses her, and then blesses Monique by putting his hand on her shoulder, and she's not Ismaili. And then he stands up and starts to talk to me. And this is a narrow corridor, and we are in a very small distance from each other. So, and he's tall. So he's literally right there And I'm right there in each other's faces. And he changes his tone completely and turns completely different in his speech. And he switches from the official doctor, cardiovascular program, all that kind of stuff, to the imam mode. And I've seen him do this to me one time before in the 1978 visit, which is another story. And he says to me, Alnoor, and I'm paraphrasing now, I don't exactly remember the words. I was totally flabbergasted with what was happening. And so he says to me, Alnoor, we've been waiting for you for a long time. We've been waiting for you for a long time to come to AKU and put this program together. Teach them how to work in teams, teach them quality cardiovascular care. And then he left. And it was probably the highlight of my career, with picking that patient and seeing Hazimam's happiness and seeing what he told me was tremendous. Princess Zara came up to me immediately afterwards and said to me that she wanted to spend more time with me. She came back the day after. I don't have that picture very close by with me. And she spent over 2 hours with me the next day. She wanted to know, how do you put a program together of this kind? How do you decide on the equipment? How do you put the teams together? She wanted to know all the nitty gritty. And I was very fortunate to be able to have one-on-one with her for over 2 hours to do that. So that's the sort of story of the first patient, massaged with a lot of emotion attached to it.